one can actually predict and tell you that you're not going to be allergic to something. But treatments of choice, in addition to the surgery, which is debulking the tumor, damage to the pancreas, is basically for discontinue all foods, intravenous line, nasogastric drip, and it can sometimes be life-threatening. In the next discussion, we'll try and look at the other factors that, in terms of heart disease, liver disease, and reproductive disease, that can be affected by chronic alcoholics. We will continue our discussion on the dangers of alcoholism and try and focus on the disease process of alcoholism rather than the person who drinks. Albeit I would try and say, quite frankly, I have nothing against persons who drink. In fact, a large number of my family and my closest friends and some of my best patients can be classified as alcoholics. But to be quite impartial, let's address the issues about alcoholism as it affects the body. In our previous discussion, we mentioned how it affects the brain in terms of memory loss, short and long-term memory loss, in terms of increasing altered behavior patterns from just being dizzy to comatose from increased pressure within the brain from a subdural hematoma, in terms of the short-term damage to the neurons to the long-term sequelae of those damage that can result in premature dementia, especially in the chronic alcoholic. We alluded to the digestive system in terms of mild bleeding from Mallory-Weiss syndrome, from coughing and retching that can cause mucosal tear, to frank bleeding from the upper GI tract that involves varicose, the esophageal varices that can actually result in sudden death because of the massive hemorrhage. We also alluded to the increased incidences of cancers, from esophageal cancers to stomach cancers to pancreatic cancers to laryngeal cancers from alcoholism. We also mentioned the increased risk factors of having damages done to the heart. Immediately after drinking, we notice that the heart rate goes up, the pulse rate increases, but we also know that the long-term damage to the heart muscle, you can develop a cardiomyopathy in which the muscles of the heart becomes increasingly thick, and the degree of contraction that happens in the left ventricle results in a decreased ejection fraction, which means that the amount of blood being pumped out of the left ventricle is decreased. Long-term drinking can lead to a large floppy heart in which the ejection fraction is much less than we anticipate for a person of a similar age. So it does cause damage to the heart and could cause a cardiomyopathy, or an enlargement of the heart results in a heart that does not contract effectively. That's the effect of long-term drinking. We all know the effect of it has on the liver. Immediately after drinking, you develop a fatty liver, which is the fatty droplets within the liver. When you do a blood test, you'll find the liver enzymes, if liver function, the ALT, the AST are increased. We continue to drink, those numbers become even increased as we go from a fatty liver, which once we stop drinking becomes normal again. Now we can go from a fatty liver to alcoholic hepatitis, which is reversible. From alcoholic hepatitis, we continue drinking, we continue to damage the liver, and the damage is shown by the increasing enzymes that occur. So your physician is able to monitor your alcoholism from the heights of those, the increase of those enzymes. But then there comes a stage where the alcoholic hepatitis and you continue to drink, you develop cirrhosis. Now that liver, which was alcoholic, which was a fatty liver, is an enlarged, painful liver. When your physician examines the belly under the rib cage on the right side and you take a big breath in, the margin of the liver will hit your finger and it can be painful. Alcoholic hepatitis also can give you an enlarged liver. But once you reach cirrhosis, that liver now is completely dead and will not be able to mount, one, a response increase of liver enzymes, neither will it be an enlarged liver. So you will find that liver is now contracting in size. So we've gone from a liver which was totally reversible when it was fatty liver to alcoholic hepatitis, which was then even reversible at that stage. Now we go to a stage of cirrhosis, which is end stage, meaning you will now suffer from end stage liver failure or liver disease. In that case, what happens, these esophageal varices get bigger. We also end up with ascites, which is this big fluid, the abdomen which is distended with fluid within it, and that is end-stage liver disease as well. We develop the flapping tremor of the hands itself. We also develop all the stigma of chronic alcoholism with the evidence of the loss of the musculature, the loss, the icterus in the eyes, the jaundice within the eyes, and all the stigma with the hair loss, the spider nevi, all the symptoms associated with chronic alcoholism and the end stage results of it. Some people even claim that alcoholism doesn't damage the reproductive system. Yes, it does. In a young person who drinks, in a young male who's a chronic alcoholic, will have a decreased sperm count. In the female who's a drinker, she will also have abnormal menstruation and difficulty actually ovulating. But more importantly is the unborn child of an alcoholic mother, because that is a child who suffers from fetal alcohol syndrome. In that case, in the child, if you now become pregnant and you continue drinking, or even in the early stages of pregnancy, you now damage that child for life. Fetal alcohol syndrome has a wide spectrum of disease processes that will manifest itself in the life of that young child. But in the first 6 to 8 weeks, when brain development is probably irreversible, that's when the damage is done to the brain in a child. We notice as intrauterine fetal retardation, the child is smaller than usual, but we also know the damage of the brain in an alcoholic mother results in a decreased IQ of that child. We also know that there are other disease processes that manifest itself in terms of some cardiac and gastrointestinal disease in fetal alcohol syndrome. But more importantly for us is to recognize that alcohol in itself might be a beverage that brings about a lot of joy and happiness within communities at times of celebration, weddings, births, etc. But the abuse of alcohol is where the major breakdown in the social fabric of our society, especially in our Richmond Hill society in particular, and probably our broader West Indian society in general, is the abuse of alcohol. And we see it from the time we're growing up as kids in the alcoholic homes, where there's much more to do with physical abuse against spouses. We also see neglect within the family. We also see the shame brought on by the fact of the alcoholism, by the disregard for the other party. But also in addition to that is to address what it does to that person in particular, what the damages it does to the brain, to the liver, to the gastrointestinal system, but more importantly is the overall effect that it does in terms of about a decreased life expectancy of that individual and a decrease of the expectancy of society on that particular individual.